Hello, welcome to AI in Action. This is Maurie, and I'm here with my husband Jim, and we are sitting once again at our kitchen table because it is a lot warmer downstairs at our house. If you hear the dogs in the background, they're playing. Anyway, we are here to talk a little bit, of course, about artificial intelligence. Now, before we get started, I would like to let you know that the primary reason that I told Jim we needed to start a podcast about artificial intelligence is because Jim is constantly reading articles about artificial intelligence and he is constantly telling me about them. And while I enjoy that, after my cup of coffee rule first thing in the morning, I do enjoy it a lot. But I'm like, Jim, we need to share this. I am an audience of one. I would love for us to be able to share what we're learning and all the interesting things that you read about and the things that I think are cool or like my perspective with more than just me and our dogs and
You're
our
a good
family.
audience, though.
I am a good audience.
You're a
I'm
good
very
audience.
attentive.
I've been very happy with you as an audience.
I appreciate that. So that's why we're doing this podcast. And we are so happy to have the listeners that we have. And if you guys want to recommend us to somebody, we just really enjoy sitting here and BSing about AI. So, first thing I want to start with this evening is a little personal story. And I'm not going to say names,
Which
but
is why you were so passionate about this episode. You're
I
not
am.
usually this passionate. Usually just kind of let me go off in the weeds and talk about
Well,
whatever I want.
I'm gonna let you go off in the weeds in just a second.
But
So
you were passionate.
we have someone that we know that went to see a nutritionist, and the nutritionist asked or gave them a lab order to do a whole bunch of different lab work.
Blood
Test. And they went into a lab. They finally found a lab that would draw the blood, and they went in, got it done, mailed it off, got the results in. And there were some things in the results that the nutritionist said were a little bit concerning. One in particular, there was a high level of something. And they were a little bit worried about it. And the nutritionist was like, well, you need to go ahead and see your primary care physician. That was weeks ago. And they tried to get in with the primary care physician. They couldn't get in. They tried to do a phone call, didn't return the phone call. When they finally got a note back from the primary care physician, the physician said that they don't normally, look at test results that somebody else has ordered, that you're supposed to get it ordered through their office before they're going to even look at it. And just real upsetting for me. And that why could they not just get a simple answer?
You know why? Because this is a big city doctor instead of small town doctor who would have just looked at it for our doctor here. Of course, we pay. We don't go
for a little concierge doctor. But even then, even the clinic, the bigger clinic here in town, I think that I probably would have gotten better results than whatever they got in the city. But the point that I'm making is that what are your options? And I hear people, and just the other day, I read a little article. I actually read a little article, short article. I do LinkedIn a lot, but it was basically that what are your options? And they're like, okay, AI can't take over. AI can't be a doctor. AI shouldn't be the one that's
Except
giving you test results.
I think GPT-4 passed the first or second level medical exams.
Right.
So maybe it can't be a doctor, but seems like it could help.
It could help.
Yeah.
And we always talk about the digital divide, about the have and the have-nots when it comes to educational tools and things like that.
We do.
Well, let's talk about that divide when it comes to AI medical care. Because if I have a lot of money, I probably have good friends that are doctors that I can just say, hey, I've got this elevated level.
Your neighbor.
My neighbor is a doctor.
Right.
Or, I have a concierge doctor that I pay a couple $1,000s a month for. If I am wealthy, that's no big deal to me. My deductible is no big deal to me. So versus us, here we are sitting right, not even in the middle of middle class. We are probably in the lower part of middle class because we're educators. But even then, we have to think about, can I have this procedure done? I need to have this procedure done at the end of the year because then I've met my deductible for the year before it all goes, rolls back over.
We tend to price out our medical procedures unless we're bleeding to death.
I know. And you have to think about it. It's like, okay, am I going to, have my electrical changed out on my house with that money I've saved up? Or am I going to allow myself to, have a cavity fix that's going to cost me $2,400? So that's the middle class problem. If I'm in lower, or if I have subsidized because I am,
Eligible for it,
I'm eligible
which we're
for
not.
Medicaid, then I just go to the emergency room, which is still flooding our emergency
Well,
rooms.
it's funny about that too, because I remember, because we've been around a while. And I
Yeah.
remember when they were talking about the Affordable Care Act before
Yes.
it, and even before it, the previous one before that, when they were trying to fix medical care.
Yes.
And I remember all the healthcare companies screaming about people, coming to the emergency rooms and
It's
treating
packed. I
it's
mean,
packed.
two, 3 hour waiting
We
list.
got to do a better job of government subsidized healthcare.
Actual healthcare.
And then as soon as the government started talking about that, then all of a sudden, not only are they against it, but then they're like, well, we have to consolidate all of this medical, this one and this one are now consolidated like we are here locally,
Right.
because we're not able to make money with the government subsidized. So on the one hand, they said we have to have it, and then as soon as they had it, they don't want it anymore.
And it's been going on for 10 years and
Oh, it's been
or
going on for
more.
longer than that.
And, our previous administrators, federal administrators, we're going to fix it. We're going to fix it. We're going to fix it. Nobody's fixed it. So what is my option? If I am in that divide between the ones who have healthcare versus the ones who have subsidized healthcare, what do I do?
Well, let's give a great example, and then we need to really talk more about the AI piece of it. But my mom
Yes.
goes in the donut hole
Yes. For her prescriptions.
for her prescriptions. So what's basically they're telling my mom, if you can live without your medication from October until January, we'll give you some more.
Yes.
Or you have to pay full price for it, which is
I think
hundreds
it's like
of dollars a month.
$2,400 that she has to pay out of pocket,
Or you can die.
which is 3 months of her Medicare.
Or you can die.
Yes.
I mean, when you start giving people no choice, they pick whatever they can.
Both of our younger children worked at a pharmacy, and I can remember both of them coming in very upset because an elderly person had to choose between whether or not they were going to pay for a prescription or basically put food on their table.
Luckily, our local pharmacist, Todd, which we should say
amazing.
nice things about him, because not only is he amazing, I mean, he has done so much, gone out of his way to help people fill out the paperwork, get
Right.
better discounts, find cheaper alternatives.
Right.
I mean,
your mother actually complains because her prescription, like the pill, changes the color or the way it looks. And I finally had to say, look, it does that because he is always shopping for the best deal for you.
right.
So he might get it from one manufacturer 1 month versus another manufacturer another month so that he can keep your costs down. And so after I told her that, she was like, oh, well, that makes sense. I don't know what she thought he was doing. Maybe she thought he was just like,
she just has a hard time recognizing bills.
Right.
So how does AI, if you have no other choice?
Well, let me tell you how AI helps.
Here's one good option. Right
that
here.
is a really good one. What do we do for the person that had the lab work done that was
We
waiting?
didn't finish that
They
story.
were waiting and waiting and waiting and couldn't get an answer.
I pulled up
You
ChatGPT on my phone. And
You said, this is the blood test. This is what the level was. What does this mean? And
it started
telling you exactly what it could indicate.
At the end, it said, oh, by the way.
That disclaimer.
You know what? I don't care. It can give me the disclaimer as long as it gives me, and it did. You know what? It may not be 100% right, but it gives me a place to start.
Well, it gave 3 options. And when her doctor finally got back with her, the second option is exactly
Which is what happened with me on my eye problem when I was seeing double. Mm-hmm. So leading right into this. So what did this lady do?
Oh, well, this was an article that came out quite some time ago. Mm-hmm. She had a son that had been like in pain.
Chronic pain.
Chronic pain for a long time.
3 years.
17 different specialists.
17 doctors in 3 years.
17 different specialists in 3 years. And she finally got so frustrated because, quoting her, she said, nobody's willing to solve for the greater problem. Nobody will even give you a clue about what the diagnosis could be.
That's the trick. Right
they
there.
don't want to put themselves out there to say, well, it might be this.
Or if you're one of these doctors with this local clinic, no name, that has to see 30 patients a day, how long do you actually have with the patient?
I worked for a clinic in Bryan College Station a long time ago, and literally the administrators would tell the doctors, family physicians specifically, that I needed to book at least 30 appointments a
And
day
you were booking for 10 doctors.
for
That's
them
a
to
lot of
break even.
appointments.
Yeah.
I don't believe that's maybe they're paying the CEO's salary of $50
It
million
was a
a year.
large clinic. But
Yes.
anyway, so what the lady finally did is she finally got AI involved. And when
Chat
she
GPT.
she went to Chat GPT, she fed in the information, told it all the
And
symptoms,
what did it say? What
and
did
it
it do?
finally, well, it said it was able to present a potential diagnosis. Hey, have you look for this? And so once she had that, which was called a tethered spinal
Right here. Tethered cord
a
syndrome.
tethered cord syndrome, she took that to another specialist and she said, hey, could we please look at this?
And guess
And
what?
that's what it was.
That was the problem.
So,
So, it when you talk about not giving people choices, what did my dad ask you the other day? Where do you want to go get his dental work done?
oh, he wanted to go to Eagle Pass.
He wanted to cross over into Mexico because he can't afford. They're poor. He's done it before. He couldn't afford medical dental insurance.
Yeah.
I mean, he can't afford the dentist here. So anyway, so where does that lead us? Where does that leave us? Where do we go with this? Well,
Right
what I
now, I'm just
collect,
ranting about
I know,
AI,
and
about medical and
to
AI.
shift you back to where do we go from here?
Hmm.
I thought for a while until that lady that's in prison now, Brian, got a hold of the world.
Yes.
I kind of thought we were moving toward the idea that I was going to walk into a room in CVS. Think about it. Most of the time you go to the doctor, you have a conversation. Unless, now the doctor we use now, that's not the case. There's more to it. But I used to complain about this all the time. I make an appointment. I spend 2 weeks trying to get in. I finally get in. I wait. They're an hour late. They show up. We have a 20-minute conversation.
If
They
that.
literally run no tests. They do nothing.
Hmm.
So my hope was that CVS and Walgreens, I was going to be able to walk into one of those. And if you guys are listening, I still want that.
Hmm.
And basically, they would have a nurse on staff. You'd walk in, and half a dozen tests would get run just while you're in the room. For example, what does this headline say right here?
Acoustic analysis and prediction of type 2 diabetes.
Using what?
Smartphone recorded voice segments.
So you walk in the room during that conversation, it's doing a medical diagnosis, and this comes from the Mayo Clinic.
Hmm.
I mean, this is so. Don't you think this is probably AI powered? I mean, it doesn't say AI, but AI is going to be involved in this somehow, where they're able to accurately diagnose it. Is it going to be perfect? That's why you have nurses and doctors still there, but at least you're running tests whenever you walk in the room doing acoustic analysis.
So there are actually differences in voices.
Yes.
Your modulation, your voice modulation is different.
Yes.
If you have type 2 diabetes.
That's correct. That's what they're saying. Now, they've got more work to do to prove this is accurate. It doesn't even have to be 100%, because you can walk in there and the doctor's going to know other symptoms that
Right.
are diabetic.
Well, you don't just look at one thing for
Exactly.
a full diagnosis.
But it's a flag that goes up. It's like
Yes.
your mailbox. Got
Yes.
a flag that went up.
It's
So
like my cholesterol level.
Yeah. So what are other things that we could do with AI?
AI laser that reads heartbeat through the throat could replace stethoscopes.
They shine a laser on your throat. You walk into, they talked about this in this article. It's a laser camera that can measure a person's heartbeat at a distance and pinpoint signs that they might have cardiovascular illnesses.
Wow.
So we walk into CVS.
Mm-hmm.
You walk into this room with a nurse. You're having a conversation first of all, you step in the room and you're standing on a scale just when you walk in the room. So now it knows how much you weigh.
Mm-hmm.
You're
Takes
talking
your blood
to
pressure,
them.
does
You're
all the
talking to
stuff.
them. So what's it doing while you're talking to them? It's analyzing your voice and looking for things like diabetes. And also you're sitting there and it shines a laser light on your throat and looks at your heartbeat and checks for cardiovascular illness.
Wow.
Again, this is kind of handy, don't you think?
Yes.
And so this particular thing, I think was this in India or in the UK? This is in the UK where
Yes.
they did this.
Well, I'm not surprised.
And so there's another option. So what else we got here?
AI platform
This was in India.
Swasa analyzes coughs to assess risk and identify respiratory diseases.
So now
there are different sounding coughs.
You mean
for
like the one I have right now that I'm trying not to cough?
They're definitely, you can tell the difference. I worked for I worked for doctors, and we would have a little kid come in, and it's like, oh, that's whooping cough, or whoops, that's we
You
would be
want to
able to
bet?
tell.
You want to bet that'll work on dogs too?
Oh yeah, our
Remember
little
Maggie?
baby.
Maggie the other
Yeah,
day, she was coughing, and we couldn't figure out what was going on with her. I bet that same coughing analysis will work on your dog too.
yeah.
You
So
can send a
again, this is an
recording.
audio thing.
This is an audio thing, but we're still. I mean, we're sitting in that room and we're having a conversation with this nice nurse who's
Hmm.
asking us some
And all
questions,
of a sudden, you cough a little
assessing our
bit.
health. You cough, you talk. It's taking your heartbeat. You've already got your weight. This is all things that you can do with AI. Remember the quote that I told you that I read the other day that I like so
Yes,
much?
college professor.
There's a college professor, I can't remember which one, who said, people talk a lot about AI ending human race. Maybe that's a possibility. He said, but as of today, it's more likely that you're going to die from something AI can help cure
Right.
than you're going to die from AI wiping out
That's
mankind.
because artificial intelligence is so capable of analyzing so much data.
And the subtlety, that's what's important is I'm sitting in a room at CVS or Walgreens, and I'm not getting paid by them to say that name over and over again, by the way. I wish I was, but I'm not. So while I'm in that room, because there's so many of those, that's why I keep talking about it. There's one on every corner, it seems like.
Yes.
So I think that when you look at, and here we go again. What is
Hong
this
Kong.
headline? Hong Kong.
Hong Kong employs AI to combat rising superbug infections. And this was in December. These are recent
They
articles.
are. And basically what they're doing is they're probably
Well,
doing
we
data
know there's
analysis.
the superbug that's been going around.
There's one for dogs too.
There's one for dogs too, but the one that we're talking about is they're afraid that, the kids are getting sick and their
Mhm.
emergency rooms are getting overran by just illness. So now they're trying
And
to figure it out.
basically, they're feeding the data they're using it as a tracking tool to track like antibiotic resistant
Mm-hmm.
strains, which is what they're talking about with superbugs.
Mm-hmm.
So in reality, they're talking about using AI in this case just to make sure they don't miss something, a trend.
Yeah.
We've gone now from individual, how does AI help you personally at CVS or Walgreens, to how does it help us globally
Infectious disease
to
control.
identify things? Because one of the things your local doctor has to have in order to determine what's going on is good information. It's
Right.
not just about them taking blood tests or whatever, it's about them knowing that there is
Where
something
it's
going
at,
on.
where the pockets are at,
Right.
where it's traveling from and
Which is
to
why
and
it's
spreading.
nice that our local doctor that we go to, Jack
It's the
Franklin,
health.
he's the county
He's the
health.
county health guy.
So he actually knows what's
Yeah.
going on in
Yeah.
the entire county, which is nice. So you're talking about a lot of different things. Now, this one right here, I put this in here. I know it's creepy. This is a 2019.
I didn't want to say
This
this
is a
on
20.
the podcast.
It's a 20. You got to think of it a little deeper. This is a 2019 Popular Mechanics article.
So it's old.
It's old, but it says AI can tell you if you're going to die soon, not by killing you, but what was funny about the articles that say it can tell if you're dying soon. We just don't know how it's doing it. But the key is the patterns.
The patterns.
Wouldn't you like to have an AI that could, for example, look for heart arrhythmias or something like that, to where that algorithm, again, we're still having that conversation with that nice nurse.
Mm-hmm.
And what if a red flag comes up? Something a doctor missed. I mean, they talk a lot about ECG. Is that the brain or the heart one? Electrocardiogram. That's the heart one.
Mm-hmm.
So they're talking about it picking up subtleties. It's no different than them picking up a subtlety in your voice that tells you have diabetes. So what they're talking about now is training the algorithm,
right,
in order to find slight changes.
Well, right here, I love where it says it's not practical to record the individual impressions of 400,000 real human doctors instead of the results of the algorithm.
AI.
But that level of granularity could show that cardiologists are more able to predict poor outcomes than the algorithm indicates.
It gives them a new tool. You don't take doctors out of it. You just give them better tools. You think about it. I mean, the healthcare people ought to be jumping all over this stuff because it's a new tool. What you have to be careful of is, well, you have to be careful. We're going to talk about that in a second, probably, but you have to be careful because it's easy for these big healthcare things to start wanting to use AI instead of doctors because it's cheaper.
Well, that's what I'm saying.
They can pay their
the
CEOs
doctor
more.
Wants the tool. It's the ones that aren't the doctors that's trying to think, how can this help my bottom line?
Yeah, get rid of doctors so I can pay the CEO that super bonus. I say that a lot, don't
Yeah,
I?
you do.
Well, you know what? Some of these guys make way when you're paying these nurses and doctors. I'm not saying doctors are poor. I mean, they're not,
But they put a lot of
but they
time and
put a
effort,
lot of time into it.
dedication.
I mean, I got to say that our local doctors here, they're never not on call.
Right.
I mean, they do a lot.
I
So,
felt sorry for the one. I was in the coffee shop the other day, and I went over and sat next to him while I was waiting for my coffee.
and they're
And
like,
I and I and I said, "Hey, can I ask you a question?" And I could tell he was like,
oh,
"Oh,
I'm just trying to drink my
I'm just trying to
coffee.
drink my coffee." I said, "Where did you get the pants you have on?" I thought I shocked. He was like, "What?" I was like, "The pants. I know my husband would like those pants. Where'd you get those
Because they had the
pants?"
nice pockets
They
on the
had.
side, and they weren't the big bulky
He
pockets.
was
Because I wear
surprised.
dad pants. Um, so this article I thought was interesting because again, it plays right along the lines. It's a very recent article.
Data, diagnosis, and drug development: the
The art.
artificial era of medicine.
Well, again, it's that quote that
Yes.
professor said earlier. What's more likely going to kill you? AI taking out the world, killing mankind,
Are you
or you
dying of a
dying from a
disease?
new superbug
Mm-hmm. The
that
AI could have
AI
caught.
could have helped you? It maybe help you find the cure for.
Yeah. Well, think of the mom who cured her son.
Wasn't there a movie like that where they found some cure for something that it had Sarah Susan Sarandon in it? It was a movie about that. I keep remembering the name of it.
Oh,
It
I
came out a
don't.
long time before everybody was talking about AI. But I mean, yeah, it was there. But anyway, there was a movie about that
But
where
she did all that in the library.
she basically did
She
all the
found all the
research.
research herself in a library. Yeah,
So
I
again,
remember it.
same kind of thing here. This doctor in this says computers can review large areas of tissue for tiny patterns
Without fatigue.
exhaustively without fatigue. So basically, they can keep looking, keep looking, keep looking, and they can look for patterns that we probably wouldn't have the time or the energy or maybe even think about.
Yeah.
And so it's like the recently I read that DeepMind, another headline, it's unrelated to medicine, but they fed something into DeepMind's AI thing, and they came up with 2 million different variations on possible materials that they could make. 2.2 million different variations on potential new materials that we could develop. Well, and it was funny because they said the ones that won't decay rapidly or explode. So they're
Not
stable.
exploding would be
Apparently that
important.
means they're stable if they
Okay.
don't go boom.
Okay. I like what he says here. He says that um, accelerating,
Disease diagnosis
yeah.
enabled patients to start treatment earlier, discovering patterns in the diagnosis. And this is all good stuff.
And it's in order to generate novel, testable hypotheses that can be applied to birth defects research and prevention. So they're just, because they have all the data and they're able to just exhaustively look at it
Well,
over and
you
over
can
and
play
over
with
again.
ideas that might seem dumb when you're thinking of them, or maybe you don't want to say something to the patient yet because you're not sure. So you just kind of want to play around with ideas and see
Hmm.
whether or not there's connections.
Yeah.
Asking it if you're, for example, like Dr. Franklin is, where you're the county medical
Hmm.
person, you might want to speculate on connections between things that they're seeing, but not actually. I mean, he can't go out to the public and
Right.
start asking
Right.
questions
Until he has
because,
evidence.
that can be, you can cause a panic with the
Right.
public. So even if he doesn't have evidence, he can explore areas that he might want to investigate, maybe connections that he wanted to investigate without scaring people.
Hmm.
So it gives him a tool to play around with it.
Right.
My dad used to tell me because when I grew up, my dad was, I used to call him a redneck philosopher, but he loved the idea of the future of science, and he used to tell me all the time that we will truly be able to expand as a species when we have a tool that you can think about things, new ideas, and explore them rapidly without having to spend years trying to figure out how.
Hmm.
That you can just play with ideas in this almost virtual world. And he was telling me this back in the 70s.
It's a whole new type of rapid prototyping.
It is. It is. I built a prototype of a web page in 5 minutes yesterday
Right.
because I could play with it, and I don't write web pages. This is the same kind of thing. I'm back to my CVS thing again. I want to walk in CVS. Not everybody has a local doctor like we do.
Mhm.
That not everybody has the
Small
Hill
connection.
Country Clinic
Hmm.
where I mean we literally can make an appointment.
Day
We
or
don't
two at
wait. We
most.
don't fill out paperwork. We got a day's delay at the most. We walk straight. And if it's an emergency,
Not
we
a
walk
problem.
straight in. There's no problem.
Hmm.
Not everybody has that. Look at the person we were talking about.
Right. Weeks.
It's going to be weeks before they
Weeks.
can get in. Now, their particular elevated protein marker that they're looking at is a long term thing.
Right. It's nothing that's critical
It's
right
nothing
now.
critical yet, but it makes them
It's a
uncomfortable. They
flag.
want to know,
It's a flag.
and they want to know. I
Hmm.
mean, they want to know because it kind of freaks you out a little bit when you
Hmm.
hear you may have a medical issue, but oh, by the way, we'll get back to you in a month, and you can come in.
Right.
It's just not the way things should work, and it is the way they work. But this last article, because we're going to run out of time, this last article I thought was interesting because it's kind of ties up what we've been talking about, which
Okay.
is this desire that people have to make sure that we understand the ethical and legal side of using an artificial intelligence. This particular one, there was a paper that's written called Medical Artificial Intelligence and Civil Liability. Well, doctors are quite familiar with civil liability,
Oh,
so I don't think you need to
absolutely.
tell them that. I think,
It's one of the reasons a lot of doctors aren't doctors. I know for a long time when the doctors I worked for stopped delivering babies.
I
And the
remember
reason they stopped delivering babies was
was,
because they could not afford the medical malpractice insurance.
yep, so the lawyers were suing the doctors so much. What do the lawyers do when they want to have a baby? If you sue people, will a doctor can they refuse to deliver a lawyer's baby
I don't know.
because
I think that might
the
be
lawyer
against the
sues
Hippocratic
people,
Oath.
or sues doctors. I mean, if you're a lawyer and you sue doctors, do you tell the doc? Do you lie about your profession
I don't know.
when you go to the doctor?
I'm sure. I'm
Anyway,
sure there's an oath that you take.
yeah,
That
but
you
you're
have to treat people.
but they can turn down patients,
They can
right?
turn down patients. No new
As long as it's
patients,
not emergency care,
and you're
then
an emergency doctor.
and you're an emergency doctor. So anyway, when you this was talking about balancing medical advancement with legal responsibility, and I agree with that. I mean, I give lawyers a hard time because I like giving lawyers a hard time, but anyway, I still think that there's a need for that because otherwise you end up with this open-ended, doctors can it makes the doctors be more cautious and they really should be. This is a human life we're talking about. This
Right.
is not, something, this is not your car you're working on here. This is a human life. So you need to be aware of it. But they're talking about how you I don't think AI makes the liability any worse as long as the doctor doesn't get lazy.
Well, due
Do your
diligence.
due
Yeah.
diligence. Use it like when you listen to a patient's heart, you're using a tool to help you determine what's going on. When you use AI and it's putting these red flags up, you look at each one and go, this one, I need to check on that. The only thing I worry about with it is the false flags, and that may be what the doctors are worried about. Not that the doctor doesn't have the sense to say, I'm not going to operate on you because an AI said I should.
Right.
But at the same time, it could probably cause doctors to follow up on things that they might not have thought they needed to follow up on, but they're afraid not to because of the liability, because the AI flagged it and you decided that I
So
don't think
then
this is a
we're
risk.
end up with more medical costs because all of a sudden the doctor's like, oh, well, maybe we do need to do that MRI, or maybe we do need to do
Yes.
that additional blood test, or yeah,
So the AIs, there has to be, just like the AI that we have for the school. We're always talking about how to give it better feedback because we don't want it giving false information. The AIs have to be, these need to be top of the line ones. These don't need to be some AI I'm running on my local PC.
right.
I mean, these need to be the ones that are capable of passing the bar
Isn't this
exam.
something that IBM Watson was originally meant for?
IBM Watson, they were doing that. They've done a lot of things with Watson, but they put them in hospitals and stuff. Doctors didn't like it, and I think the doctors kind of probably sabotaged it a little bit because they didn't want to use it. I do think that Watson was ahead of its time.
Yes.
It's still here, but I think that even IBM was trying to sell it as a way of reducing costs. You don't need as many doctors, you don't need as many nurses.
Mm,
I don't know if that's true, but I kind of get the feeling it was. Anyway, we're about out of time.
okay.
But we went off on a rant, I realize, about medical because we've had these issues lately. And the paperwork you're filling out for my parents and it's just crazy. It's
AI can
something that's
help.
got to give.
AI can help.
We hope so.
So this is Maury here with my husband Jim, and we really appreciate you listening to AI in Action. We will catch you next time. Hopefully, you guys have a great rest of the week.